Hello, ladies and gentlemen. Today I am speaking about one of the most important diseases in this century. It's obesity. Of course, due to the development in this century and due to the development of remote control in all our life, obesity is one of the most important and serious diseases in this century. Before, we said that obesity is not a disease, it is a syndrome. This means that certain diseases such as diabetes mellitus, one of its symptoms is obesity. But due to the development in this century, we can't say that it is a syndrome. We can say it is a syndrome. It is not a symptom. Obesity, of course, as is its definition, means increase in the body weight by about 15% or more in relation to the same sex and height and age for comparison tables. Now we speak about types of obesity. Obesity can be classified into three main types, whether it's simple obesity related to certain areas, such as hands, buttocks, lower abdomen, and so on. This relates to the contour itself and not related to element of increase of body weight. Second type of obesity is what is called moderate obesity. And moderate obesity, you can say that 15% or more of the body weight is present here in relation to comparison tables. And the third type of obesity is morbid obesity, in which you can find the body weight is increasing by a horrible weight, and it can affect everything in life of this patient. Now, we speak about complications of obesity. Obesity has many complications. For example, no organ in the body cannot complain of obesity. For example, as for the cardiovascular system, you can find increase in the hypertension, and there is precipitation of cholesterols and low lipids, low density triglycerides on wall of arteries and veins and capillaries, and accordingly there is increase in arterial blood pressure, followed by cardiac ischemia or even cardiac infarction. Also, you can find catastrophes such as cerebral hemorrhage and so on. This comes first from obesity. Also, you can find patients with horrible or tender on pancreas who can find diabetes mellitus, accompanying obesity. I can complain of obesity by retinal hemorrhage and so on. All joints of the body can complain of obesity by heaviness of the weight and inability to move. We find heaviness of the weight can complain on the cerebral discs, can also complain on the low lumbar discs and so on. Also, what is known later is that about 30% of unknown causes of infertility in both males and females of unknown etiology can be caused by obesity. So obesity can affect every organ in the body. Even in the skin, you can find precipitation of cholesterol in the form of xanthomas in the lower and upper eyelids. Also, you can find precipitation of cholesterol in the skin, forming what is known as skin nodules or cholesterol nodules and so on. Now, what about diagnosis of obesity? In order to diagnose obesity, first I'd like to speak about causes of obesity. The first cause is hereditary cause. Till last 10 years, we cannot say that obesity has a hereditary cause, but now we can say, because it is proved that there is certain gene on chromosome number 17 is responsible for formation of obesity. Secondly, endocrinal causes, and this is related to the change, hormonal disturbance of endocrine glands, such as pituitary gland, which is present in the base of the skull, or thyroid gland, which is present in front of the neck, and even on the suprarenal gland, which is present on the lower part of the abdomen posteriorly. All these can affect also obesity. Also, there is a certain type which is called neuropsychological disturbances. Any patient with psychic shock or psychic trauma, the first complaint is obesity. Lastly, we can say that the development in this century and presence of all types of remotes can cause and promotes the formation of obesity. In order so to diagnose obesity, we can find that obesity can be present by different types of investigation, whether to say what is known as mass number, in order to count the mass number, or to perform X-ray on different parts of the skull, or to perform hormonal assay on different hormones, different types of the body, whether urinary 7 ketosteroids, or hormones of the thyroid gland, or hormones of the pituitary gland, and so on. Now the case is settled, and the patient complains of obesity. What about treatment? Line of treatment depends on 3 routes. The first is the nutritional route, and the second is the sports route, and the third is the will of the patient in order to decrease his body weight. And for this chance in this holy month, it's an important time. It's a must for any person complaining of obesity to fast Ramadan. Why? Because fasting is it is a very important and very interesting proportion in order to have decreased body weight. How? As I have said, to control obesity, I have 3 routes. The first route is diet control. How to control diet and how to take this in order to decrease the body weight during Ramadan. At first, I have to say, we have to take only 2 meals. The first meal is after fasting, and second one is before the next fasting. We have to take dates, and then you have any person to take a cup of soup, which is slightly warm. Then you can take a small cup of rice or a small cup of macaroni. Then you can take just a piece of meat, about 150 grams, which is soiled or which is fried. Also, you can take a quarter of 1 chicken or quarter of a fish. This is to start with, and this is after fasting. Then you have to wait for about 1 hour in order to take fresh soaps. Or I can take any fruit. This fruit can be apples, can be bananas, can be dates, and so on. Then you can take just fresh fruits at 11 or 12 p.m. in order to take the last fasting. Before fasting, you can take either yogurt, or you can take a piece of bread. Also, you can take 2 soiled eggs. Or you can take some beans. If you do just this, away from sweets, away from fatty fruits and fatty meals, you can control your body weight. And you can take this chance in order to decrease your weight during Ramadan. This is very important, and many of the regimes to be done and to be written is related to take this chance in order to decrease body weight during Ramadan. The second route is to use the sports manner. And the sports manner is very important. Why? Because the sports manner, firstly, we can use sport to burn fat as a source of energy. Secondly, we can use through sports to decrease precipitation of low density lipoproteins on the wall of the arteries and on the wall of the veins, and accordingly decrease the blood pressure, and accordingly prevents cardiac ischemia and cardiac infarction and so on. Thirdly, we can, through sports, we can use it by burning of the fat of the muscles is less than burning of fats all over the body, and accordingly your muscles becomes stronger and stronger. This is a very important idea about sports. Lastly, the third route, the first route in my treatment of obesity is nutritional route. The second route is sports route, and third route is the will. You must have the will to use this chance in this holy month to decrease your weight. You must have this will in order to decrease your weight. Otherwise, there is a very important role, which is role of surgery, plastic surgery in treatment of obesity. And the role of plastic surgery depends on 3 main lines, depending on what is known as mass number. And the mass number is the division of the mass of the body over the square of the height of the person in meters. If this mass number is between 18 and 20, so this type of obesity is simple obesity, and it is the problem of contour of the body. In this way, in plastic surgery, we perform what is known as liposuction. And liposuction can be done from the buttocks, from the upper or inner parts of the thighs, from the haunch, and so on. And second type of obesity, which is moderate obesity, such as there is pendulous abdomen, we perform certain type of operation, which is formed of three types of operation. It is liposuction of the fat in the anterior abdominal wall, plus duplication of the recti muscles of the anterior abdominal wall, plus dermalabectomy of the fat present on the skin, which is pendulous in the abdomen. This type of operation is performed in the moderate type of obesity, in which the mass number is about 30. But in horrible and morbid obesity, in which you find the mass number is about 40 or more, we can perform a certain type of operations, all related to the stomach. These types of operations related either to suturing of the stomach or application of the ring at the lower end of the esophagus before entering into the stomach, or application of the ring along the mid part of the stomach. All these operations can be done through laparoscopy, and they can decrease the size of operation of this patient to the certain limit in which can take a result after about 6 months. Therefore, I like and insist to take this holy months to try to decrease our body weight. Try to take a lot amount of vegetables, green vegetables. Try to take soaps. Try to take great amount of smoked or boiled meat or vegetables and so on. Try to be away from sweets. Try to be away from certain types of meals which can increase your body weight. Try to control your body by walking. Just walking about 1 hour after you take your meal. All this in detail can be a very good idea and can decrease the body weight. And we can take this honor months in order to decrease our body weight, and it's a must in this month to fast. Thank you.